Thank you everybody for joining our COVID-19 press conference. Just a couple housekeeping items. We'll do a short presentation and we'll have a Q&A at the end. As always, if you would like to ask a question, please just raise your hand. You can do that through the Zoom menu bar and we will call on you. You can ask your question towards the end. If you do have a question that we don't get to or any follow-ups, you can always send it to our email that's in the top right corner. media_info@state.co.us, and we do have translations available. So we have a Spanish language channel as well as ASL interpretation. If you go to the Zoom menu, you can switch to Spanish if you would like. Okay. So today with us, we have Brigadier General Scott Sherman, Dr. Rachel Herlihy, State Epidemiologist, and Dr. Eric France, Chief Medical Officer. Today, we will be going over an overview of COVID in Colorado, as well as an update on the vaccine distribution, and we'll have some news for you about COVID-19 treatments. With that, I will turn it over to Dr. Herlihy.
Great, thank you so much. Good morning, everyone. So first, to start off with a recap of the numbers and where we are in the state right now. Overall, you can see that the number of cases we're having in the state have been declining over time. So each of the vertical gray bars in this figure show you the daily case counts in the state. And the red line is showing you our 7-day moving average, which is really just a smoothed out line that helps us see trends a little bit more clearly. So what you can see is that we were decreasing in November. We had a little bit of a holiday spike that followed Christmas and New Year's, but since that time, we really have been steadily declining. If you look at the slope of the curve that we've been seeing the last couple of days, you can see that we're decreasing a little bit more slowly than we had been in November, but certainly we do continue to see a decrease here in Colorado and a steady decrease at that. Next slide. So this figure shows you the number of cases that have occurred in Colorado compared to other states across the country. And it's shown as an incidence rate or per 100,000 population. So we can compare the rates in Colorado to other states. And what you can see here is that Colorado is towards the very bottom of this figure, meaning that our overall rates are really pretty low compared to most states in the country right now. So Colorado continues to be in a pretty favorable position compared to the rest of the country. Next slide. This figure shows you our hospitalization trends over time. Once again, you can see that from our peak in late November, early December, we've really had a steady decline in hospitalizations in the state, and that trend has continued in the last couple of weeks. Next slide. This next figure shows you the difference between Colorado hospitalizations and US hospitalizations. So I would point out here that Colorado began to decrease sooner than most states in the country, meaning that we really slowed our increase in cases earlier than most states in the country did. And you can see that the overall peak in Colorado was less than the overall peak in the US, but certainly good news that we are seeing a decline in hospitalizations, not just in Colorado now, but in the country as a whole. Next slide. I want to briefly talk about the variants of COVID-19 that we are seeing occurring in Colorado and across the country right now. So far in Colorado, we've had a total of 16 variants identified. Most of these, so 13 of them, are the B117 or UK variant. We've also had 3 instances of the L452R variant. And this is a variant that has been causing some infections in California, also some countries in Europe. At this point, it's really still a variant that is under investigation. CDC is actually not yet listing it in their count of variants on their website, but we do know that it has caused some concerning outbreaks in California. And so while we're continuing to study it across the US and the globe, we are tracking it specifically here in Colorado. So again, 3 cases of that L452R variant or California variant, as some people are calling it. These 16 cases have occurred primarily in the Metro Denver area with a small number in the Western Slope. So right now, our goal is to sequence about 200 to 300 of these specimens of 300 to 300 of cases that occur here in Colorado, to have specimens from those cases sequenced at our state lab, with an ultimate goal of about 5% of positive specimens each week. We think we're probably close to about 3% right now, and that 3% goal is really the national goal at this point. So we really are on track to exceed that national goal, to make sure that we are able to detect any variant cases that are occurring in Colorado and detect any changes in the prevalence of that variant in the state or variants in the state over time. And I will hand it over to Brigadier General Sherman.
Thanks, Dr. Hurley. Good morning, ladies and gentlemen. Just to give an update of our progress so far. Currently, 90% of Colorado's frontline healthcare workers have received both doses of vaccine. 100% of skilled nursing facilities have received their first doses, with 71% have received their second. This progress in phase 1A means that we're now turning our full attention towards phase 1B. Next slide, please. So we're proud to say that 90% of moderate risk healthcare workers have received their first doses of vaccine, and 39% of all Coloradans age 70 and older have received their first dose of vaccine. That 39% equals 220,000, well over 220,000 Coloradans 70 and up, which means we're roughly 56% of the way toward our goal of vaccinating just a little over 393,000 Coloradans. So 70% of our population 70 and above. Next slide, please. So just kind of give you an update of the community vaccine clinics. First, this past weekend, we had 5 health equity clinics that vaccinated approximately 1,200 people, so 1,200 doses. You see them listed there. Then we also had UC Health, National Jewish Health, 13,000 doses, and the National Jewish Health will also be going next weekend too, or this coming weekend. And then this week, we have 8 equity clinics that are scheduled, administering 3,440 doses. So, and just a reminder that all these events are appointment only. Next slide. So this chart shows our best estimates for what weekly allocations from the federal government will look like moving forward just through the end of February. This is a fairly conservative estimate, and there's potential for these numbers to rise, but we certainly do not anticipate this supply to diminish moving forward. This estimate includes the 16% increase that the Biden administration announced, and also includes an increase of just this week only of returned vaccine that we got back from CVS and Walgreens from the federal long-term care facility program. Given these numbers, we estimate that we will receive roughly 452,000 doses between last week and March 1st. While we are seeing some increases in supply of vaccine and we are making considerable progress, I do want to stress that Colorado is a state of almost 6 million people. So it's going to take some time before we can expand access to the general public. Next slide, please. The last slide showed the total estimate of allocation that vaccines that Colorado is going to receive. This slide shows the number of those vaccines that would be utilized for Coloradans 70 and older. Given these numbers, we're confident that we'll be able to vaccinate enough Coloradans each week to reach our goal. We estimate there's roughly 562 Coloradans, or 562,000 Coloradans over the age of 70, and vaccinating 393,639 will get us 70% of the way through the group. And you see with the estimates that we have right now, that we're going to be well over our goal of reaching beyond the 393,000. Next slide, please. So with a clear path toward inoculating our 70 and older population, we're now looking towards the next step. As Governor Polis announced on Friday, this includes the additions of 1B2 and 1B3, which I'll talk a little bit in detail more in the next few slides. So let's go ahead and move to the next slide. Just to remind everybody that we still have phase 2 and phase 3. Depending on what allocation we get. Right now, we're currently estimating that phase 2 we'll get to in the spring, which is people age 60 to 64. and then people with one high-risk condition for health, and then phase 3, early summer for general public. Next slide, please. Okay, so phase 1B2 prioritization. This group includes Coloradans aged 65 to 69 years old, child care workers, and then our pre-K through 12 educators and school staff, including teachers, that's both full-time student teachers and substitutes, and then the staff, including the bus drivers, school food service, counselors, administrative staff, safety workers, and other support services offered inside the school. And then, of course, the state government, members of the executive, legislative, and judicial branches that are getting vaccinated for the continuity of state government by our Constitution. Next slide, please. So Coloradans age 65 to 69 will have the ability to sign up the exact same way that Coloradans 70 and older do. This will enable them to sign up with a local provider to join the wait list and schedule an appointment. Eligible Coloradans can visit covid19.colorado.gov for the latest contact information from local providers, including the vaccine sign-up site and their vaccination hotline. Coloradans can visit covidvaccine.org or call 1-877-COVAX-CO to find contact information for providers across Colorado. Next slide. So school district schools, child care providers are working with their healthcare providers, including hospitals, local public health agencies, to schedule vaccinations. Employers will be in touch with more information about how to schedule your vaccine. Those who have not already partnered with a provider to vaccinate staff should contact their local public health agency or healthcare provider to get that coordinated. Next slide, please. So phase 1B3 prioritization. This phase includes frontline essential workers and Coloradans aged 16 to 64 who have 2 or more high-risk conditions. Within this category, frontline essential workers include food and agriculture, manufacturing, U.S. Postal Service, public transport and specialized transportation staff, grocery, food service, public health, frontline essential human service workers, and direct care providers for Coloradans experiencing homelessness, and essential frontline journalists. For Coloradans aged 16 to 64 with 2 or more high-risk conditions, those conditions include Coloradans with cancer, either those Coloradans who are receiving treatment or have received treatment within the last month for cancer, chronic kidney disease, COPD, diabetes, Down syndrome, specific heart conditions which are listed there, severe obesity, pregnancy, sickle cell disease, solid organ transplant, and people with disabilities that prevent them from wearing masks and social distancing. Next slide, please. So our goal right now is to start vaccinating the group in phase 1B3 in early March. We're estimating somewhere around March 5th on our current allocation. These numbers are flexible based on the number of Coloradans included in previous phases, as our numbers are estimates based on the latest census and demographic data. And allocation, of course, allocation of the vaccine from the federal government will play a huge part in this. Next slide, please. So how to sign up for frontline essential workers. Frontline essential workers, like educators, will be employer-based efforts. We continue working with stakeholders to create a process for how best to vaccinate this group, and we'll have more information about how to sign up soon. Now I'll hand off the rest of the presentation to Dr. Eric Frantz.
Thank you, Brigadier General. Good morning, everybody. I'm Eric Frantz. I'm the Chief Medical Officer, and I'd like to take a little time to tell you about our program to promote the use of these new novel treatments for COVID disease. You may be aware that neutralizing monoclonal antibodies have been shown to be effective at reducing medically attended events as well as hospitalizations for people who have mild to moderate COVID. And these are outpatient treatments that are provided through an infusion that takes about an hour, and they can be done in hospitals, infusion settings, and require a second hour to be observed. These have been available to the state through a federal program. Both of these products were approved by the FDA in November through emergency use authorization. Next slide, please. The emergency use authorization was very specific about who should be receiving these medications. And really, it just reflects the people who were enrolled in the trials that looked at how effective they were and how safe they were. And so they aren't really for everybody. You begin, of course, by being a person who's tested positive for COVID. If you happen to be hospitalized or on oxygen, you actually are not eligible. So some of these earlier therapies like remdesivir, we think of as being hospital-based. This is really more of an outpatient setting. If you have a baseline use of oxygen and your oxygen level goes up because of COVID, then you are not eligible. However, if you have baseline oxygen and it has not gone up with your COVID illness, then you can receive these therapies. Then the next requirement is that you meet certain criteria for severe disease, and I'll talk about that in a moment. But folks in general who are healthy and well, who test positive for COVID, are not eligible unless they have one of these conditions. These are risk factors that put you at high risk for developing severe disease and to be hospitalized. And then finally, the requirement is that persons receiving this have only been sick for 10 days or less. So if it's been a longer period than that, then they would not be eligible for one of these monoclonal neutralizing antibody therapies. Next slide. So here's a list of the at-risk conditions, and think of them again as the criteria for participating in the clinical trials. A body mass index, BMI, of 35 or more, chronic kidney disease, diabetes, an immunosuppressive disease, age 65 and older, or for persons 55 years of age and older, if you have cardiovascular disease, high blood pressure, hypertension, or lung disease, chronic obstructive pulmonary disease, those would all allow you to qualify for this therapy. There are also conditions for which an adolescent aged 12 to 17 would also qualify. Those include similar conditions as you see listed above, as well as obesity in adolescents. Next slide. These medicines are free and they are widely available. We have 26 different sites across the state now that are taking reservations and referrals from doctors for these therapies. We have a website at the State Department of Public Health and Environment. If you look for COVID-19 treatments, it will describe to you further detail about who qualifies and how one can get signed up for one of these therapies. So when the state started doing this work maybe 2 months ago, we were at a place where we were concerned that there would be fewer doses than the demand. So our supply would be short, a bit like we're in with the vaccines. That really hasn't turned out to be the case. When we built our program in this state, there were two important principles that we were looking for. First, we wanted to be sure of geographic distribution. We didn't want it only available to people in a metro area or the Front Range. And so you'll see here that we do have things nicely distributed around the state. Secondly, we wanted to be sure that we had a fair program that provided equal access. We didn't want the doses to only go to people who historically used one of the large health systems like SCL, Banner, or UC Health. That seemed unfair if you had to be in one of those care delivery organizations. So we did build a random allocation tool where if the number of people asking for it was much higher than the doses we had, the physician making the referral would simply push a button, and based on the odds for that week, we would determine whether or not somebody would receive it. At this point, the supply of these therapies is very high. And so anybody who is referred and meets the criteria will receive it. They are not randomized to receive it at this time. That structure exists, however, so that if something did change in the future, we could use such a tool to be sure it was fairly distributed across the state. So in the meantime, we're currently, on average, there are about 100 people a week who are registering and at one of these infusion centers. Those numbers seem low. There's some folks who are sick with COVID and start feeling better and decide not to undergo therapy. There are some questions around the science around these therapies. Remember, these were through an emergency use authorization. And while they did show 50 to 70% reductions in hospitalizations and clinic visits, it was based on small numbers in phase 2 earlier trials. And many of the doctors are still wondering whether these treatments provide as much value, and so aren't necessarily referring their patients in for these therapies. I think it's important that any resident in Colorado who meets the criteria, who's positive for COVID, have the opportunity to be aware that these exist and talk to their doctors about whether it would be right for them. They can learn more too by going to the CDPHE website that discusses treatments. Next slide, please. So at this point, we will open it up for questions for the group.
Absolutely. Thank you, Dr. France, and thank you, Dr. Herlihy and Brigadier General. We will start with questions and answers now. So if you just want to state your name and where you're from when I call on you, that would be great. Let's start with Meg Wingerter.
Hello, this is Meg Wingerter from the Denver Post. So going forward, as the categories expand for the vaccine, is there going to be any attempt with the randomization to try to prioritize people who were in a higher priority group? For example, somebody who's 70 and hasn't been able to are they going to be in any way prioritized over the people in their 60s and teachers?
Well, for people that haven't signed up, you know, if you're in a previous group and you haven't gotten a vaccination yet, you're certainly, anybody in a previous group, you're allowed to sign up. Anybody that wasn't able to get an appointment or was hesitant at first to get a vaccine, you certainly can sign up. I wouldn't say prioritization, except because of teachers and frontline essential workers, we're going to be working through employers on most of that. So there should be appointments available for 70-year-olds that were, you know, decided or could not get an appointment. So that's the way we're working it. It's really for the providers for appointments is going to be 70 and above and 65 to 69 so that we can make good progress on that. And certainly our goal, you know, beyond 70% is to get 100% of that done within March to make sure we have that, you know, 70-year-olds and above completed on vaccinations, and then finish up with 65 to 69.
Thank you.
Okay, let's go to Jacqueline Allen.
Hi, I'm Jacqueline Allen with Denver 7. My question is involving nursing homes and visitation when it comes to the vaccine. We're hearing from some of our viewers asking questions about this, and they want to know, after both vaccines have been administered, when will regular visitation start up again?
We do have a little time before that will be occurring. We'll be looking to CMS, which really does all the regulations for the skilled nursing facilities, to help us with guidance. I think in general, of course, we agree that once you've had these 2 doses, and it's been 2 weeks after your second dose, that these vaccines are very effective, and visitation should be encouraged in a safe way, of course. We do recommend, even today, outdoor indoor visitation based on the recommendations to date. You might remember a month ago that we announced we wanted to withhold or reduce indoor visitations while we studied more the prevalence of the COVID variant here in Colorado. And I think we had maybe even a press release today just clarifying that or at least it will be coming shortly, saying that we have seen that the variant is not prevalent in Colorado at this time. It isn't responsible for outbreaks in nursing homes, large outbreaks that we've seen to date, and therefore we'll be recommending to return back to the current active outdoor and indoor visitation recommendations. That's a bit separate from the second part of your question, which is now how will that change that people have been vaccinated in these residential care facilities? And we do expect it to change, and we're working on that, and know that we have to look to both CMS and the CDC for their guidance because we have to stay within their guardrails.
And do you have any kind of a timeline right now for when that will happen? I mean, people want to touch their loved ones again. So I think the question is there a timeline?
I would imagine, well, first off, you should talk with your skilled nursing facility and assisted living facility. They should have clarity on how they do indoor visits today and outdoor visits today. And so that's the first piece where by connecting with them, they can learn how they can visit somebody in the next week or two. And then probably within the next 2 weeks, I imagine we'll hear more from CMS and the CDC.
Okay, let's go to Seth.
Hi, thanks. 2 questions. First, I noticed on the new vaccine priority list, there's not sort of the catch-all term of immunosuppressed or immunocompromised. I wonder if you guys can talk a bit about that and why it looks like there's a bit more targeted to certain conditions. And 2, kind of piggybacking on that last question, once someone is vaccinated, what can they do? What can they not do? What doors are open and what remain closed for now? Thank you.
Rachel, you want to take first
Sure.
stab, and I'll jump on as well?
Sure, yes. So I think important to note that the recommendations around those chronic medical conditions, including immunosuppression, really come from CDC primarily. And so CDC on their website lists conditions where there is clear known increased risk of COVID severity of disease. And so that is not necessarily for all immunosuppressive conditions. It is very specific conditions. And so we're really following CDC's lead on that and looking to the data and the science that exists around where we believe that there is increased risk. And it does not appear that that risk, or at least the evidence we have at this point, points to all immunosuppressive conditions being, significant risk factors for severe outcomes due to COVID-19. To the second question, I think it's important to recognize that this vaccine, like all vaccines, is not perfect. While we believe that, there is a high degree of protection for individuals who receive 2 doses of this vaccine and then are 2 weeks out from that second dose of vaccine, we know that there is still a small risk for these vaccines, probably approximately 5% risk of individuals becoming infected after they have received the vaccine. And then the other thing is we're still learning really much more about how individuals' immune systems respond to this vaccine. We know that there is a small risk, a theoretical risk, that individuals could potentially still become infected with the virus, but not necessarily develop symptomatic illness. If you look at the vaccine studies that were done, really what they're measuring for the most part is whether individuals developed symptomatic infection. And so there's always the small possibility that individuals could see a benefit of the vaccine that prevents symptomatic infection, but not necessarily asymptomatic infection or sort of this asymptomatic carriage of the the virus. So I think the short answer is that we're really still learning much more about this particular virus and how the vaccine interacts with our immune systems. And we also know that, while right now we're vaccinating the population and individuals are protected, we're not going to be at a place where we have population level protection. So community level protection, herd immunity for many more months to come. And so in general, the population is going to be at risk for months more to come. So again, I think we're still recommending that vaccinated individuals continue to follow recommendations around mask wearing and social distancing to make sure that we can keep our population as a whole, our community as a whole, safe during this time.
Okay, let's go over to John Daly. You there, John? Okay, we will come back to him. Let's see, Andrea Dukakis.
Yeah, this is for Brigadier General Sherman. I was wondering, you've built a system in the state where the bulk of vaccines are going to large healthcare providers, and then they have 3 days to, get those vaccines into folks' arms. And I just wondered, or am concerned that by creating that situation, it might be guaranteeing that the distribution isn't equitable. And just to follow up, I wondered when or whether you have plans to start letting folks where the vaccine is going specifically around the state.
Yeah, I think we'll be a little more transparent on where vaccines going in the state. We're working hard on equity. That's why you saw that I put up that slide about making sure that we have clinics that are specifically focused on the underserved population. So I think that's a real big thing. And then also, part of the I should say allocation that's coming back from Walgreens and CVS. We're only taking about half of it that they don't need for the long-term care facility program. They're actually opening up clinics. I think Walgreens is going to open up about 40. CVS is going to do, I think, one really large clinic at one of their pharmacies, and we'll certainly get that information out. Yes, if we could get more vaccine, we certainly could do it. Do I want to get the pharmacies more involved in it because they're 40% of our business in Colorado as far as 40% of getting vaccine out? Yes, we want to. And we're certainly hoping here in March that the amount of vaccine increases substantially so that we can get vaccine at every pharmacy, every provider. We think that's somewhere above 300,000 doses a week where we can make sure everybody's included so that we can do that. And then once we get above 300,000, that's also where we look at, bringing in FEMA, DOD to run larger clinics too. So that's certainly what we're looking at. And it's certainly what we want to do, Andrea.
If I'd add to that, Andrea, I'd just say that maybe at the high level, there's two arms to the work. One arm is in partnering with health systems and local public health agencies for large vaccination initiatives. And in there, we're having conversations with these organizations to say, how are you addressing the natural imbalance that happens from an equity perspective in the way you're doing it? So we know that a natural large program might find that the people who live in low-risk communities have higher rates of vaccination than those who live in high-risk communities. They may have lower rates of vaccination. So we're asking from these partners to help us understand their plans to address that. Do they identify certain zip codes, invite those folks in first? Do they work with different community organizations to really engage local area communities into their large area events? So that's one arm. The other arm are the equity vaccine pop-up events, which kind of helps fill up the remainder space, if you would, so that, in general, these mass interventions will grab the majority of people. We know that disparities will come from that, and work needs to be done to bring up the rates in communities of color, low-income communities, where they have higher risks of disease, higher risk of hospitalization and death. And so it's a two-armed strategy in that regard.
Great, thank you. I think we have time for just a couple more, so let's go to Nelson Garcia.
Hey, this is Nelson Garcia from 9 News. General Sherman, back to the issue of teacher vaccinations. I understand what you're saying about logistics, and I appreciate what you're saying about the two different systems for teachers versus those who are over 70. But we're getting a lot of emails from folks who are nervous that when teachers start receiving vaccinations, that they feel like, you know, what's left for me? What can you tell people over 70 who are anxious about the process opening up for teachers next week and they still haven't received their vaccines?
Well, I would say, first of all, on our allocations, all of our allocation this week is going for 70 and above community, but we're actually putting either somewhere between 65 to 35% of our allocation will go towards 70 and above to make sure we can continue on with that community and make sure that 70 and above or get vaccinated. And then, of course, we've got to work with the providers that are providing vaccine to the school districts and make sure they have enough too. It's certainly a priority for us to make sure that we get our most vulnerable population vaccinated. So we're certainly working with the local public health agencies and the providers to make sure we give them enough vaccine so that they meet their appointments and that everybody gets on the wait list so that we can make sure that when there is vaccine available that they can get vaccinated. That's most important. Let's get on a wait list so that you can get called for a vaccination as soon as there's appointment available.
Okay, let's go to Ivan Rodriguez.
Hey, this is Ivan with Denver 7. I had a couple questions since we have that deadline approaching at 5 p.m. for the public comments on Dial 2.0. Could you guys give a little bit more detail on what that 2.0 dial means, what the changes mean for Coloradans, and going down into the future, whether it's, you know, that 3.0, 4.0 change in dial, what will those mean down the line as well?
In general, I think for the dial, we're still waiting to get feedback from general population. It makes sense if you think about the lifespan of a pandemic, that there are different interventions depending on where you are. Now we're in a place where healthcare workers and are most vulnerable, are most likely to die or be hospitalized, are becoming vaccinated. And so it's a different place than 6 months ago when the dial was built in partnership with communities. So because we're in a different place there, we have a different runway for vaccinations going forward. And of course, this important desire to open up businesses and to solve for the crisis at hand, we have to rethink the dial and rethink about what prevalence of disease, incidence of diseases in a community, positivity rates, hospitalization rates, these different things may have a different role for the next iteration of the dial, which is absolutely what we should be doing given we're in a different place in the pandemic. So more to come. We're still in the process of hearing from our stakeholders before we're ready to talk much more about it.
And Ivan, we can give you some more info if you send us an email. We're happy to follow up with you on that. Let's see,
That would be
Kim.
great.
Great. All right, Kim Posey.
Hi, I was just wondering if you could talk a little bit about the difference in the amount of vaccine that we are getting and the accessibility of it moving forward. We all know that people 70 and up have, sent in their emails saying it has been difficult for them to get appointments and things like that. So moving forward, when we open things up to 65 and up, how will things be different? Are we getting more supply? Are we more streamlined? And what is the best way for people 65 and up to register? Do they need to register multiple places, or do you think they'll be able to get in more easily?
So I would urge everybody not to do multiple places, to go with one provider and register there on a wait list, because if you do register multiple places, then that just holds up an appointment that somebody else could be using. So yeah, we're going to be doing allocation and working with all the healthcare providers to say this is the percentage we want to have 70 and above, and this is what we want to have 65 through 69. And then, of course, we'll have a certain amount of allocation for the teachers, because it's certainly our goal to get 75% or greater, all depending on how much or how many of the teachers are going to take the vaccine, or in the education realm, I should say. Everybody that's there, we're hoping somewhere between 75 and 80% or higher for that. So that will also do our allocation, or will guide our allocation to make sure that we get that done. We're really the goal of getting that done by March 5th, so that we can get the teachers with their second dose before spring break, so that they can go ahead and have 2.5 months or so of in-class education. So that just really helps our students. And then our focus is going to be on 70 and above to get them. Like I said, our goal is 70% of 70 and above by the end of February. That's certainly our goal. And then the rest of the allocation will go towards 65 to 69, knowing that a majority of that population, I shouldn't say a majority, about half of that population is going to have to wait till March to get their vaccine, their first dose vaccine completed.
Okay, I think that's all we have time for today. I want to thank our experts for joining, as well as both of our interpreters. I know there's a couple questions we weren't able to get to, so again, please just send those our way at media_info@state.co.us. Thanks, everybody.